I start by washing my hands and performing hand hygiene. Hi, how are you doing today? My name is Talbot, and I'll be your nurse.
I'm doing good. How are you?
I'm doing well. I see that there are no visitors here, and I check the room and the bed for any potential hazards, and there are none. Can I see your wristband, please? All right, thank you. And I check it against the medical record, and it looks the same. And can you state your name and date of birth, please?
Sarah Taylor, 12/1/2000.
All right, and it is the same. And do you have any allergies?
Penicillin.
Penicillin? Okay, I'll note that. And I perform a general assessment of her, starting with her airway and breathing. And her airway is open. Her breathing looks unlabored. Her circulation, her skin is dry, warm to the touch, and pink. And she is awake, alert, and she responds to questions appropriately. Okay, and upon checking the room, I check her person, and I see that she is on room air. There are no drains connected to her, and she is not connected to an IV. I check her vital signs, and her vital signs are 120/80. Her respiration rate is 18. Her SpO2 is 96%. Her pulse is 68, and her temperature is 98.5. And those are all within normal limits. And do those sound right to you? Are there any fluctuations that you think might be off?
No.
All right. And are you in any pain today?
No.
Okay, if you were, I would use old carts. I would assess your onset location, duration of your pain, character, aggravating factors, relieving factors, timing, and severity. Okay, now I'm going to check your eyes real quick. All right. And can you look towards me? All right. And her pupils are equal in size. They're 3 millimeters in diameter. They're rounded. They react to light, and they show accommodation. And are you having any trouble swallowing right now?
No.
Okay. And can you tell me where you are right
Right Point Community
now?
Hospital.
Hospital. And who brought you here?
Myself.
Oh, okay. And what is the date today?
Today is Wednesday, December 7th, 2022.
All right, thank you. Can I check your mouth, please? All right, and can you say ah? Okay. Her mucosa are moist and pink, and her teeth are present and intact. And now I'm going to take a look at your heart and your lungs. Okay, and every time I move the stethoscope, can you breathe deeply for me? All right, anterior and lateral breath sounds are clear. And I'm going to check Herb's point to get your heart. All right, heartbeat is regular. S1 and S2 heart sounds are noted. No murmur is detected. Are you having any breathing problems or chest pain?
No.
Okay, and now I need to check your back for a second. All right, posterior breath sounds are also clear. Now I'm going to check your abdomen. All right, I check all 4 quadrants. for 1 minute each. And bowel sounds are normal active, about 8 a minute. I also see that there is her contour, her abdomen is flat, and no distension. The skin on her abdomen is normal for her race, warm and dry. And have you voided recently?
About an hour ago.
Okay, when is your last BM?
This morning.
Okay, and have you had any nausea or vomiting?
No.
And how is your appetite? Have you eaten today?
Yes.
Okay, and did you eat everything that you made for yourself?
Yes.
Okay. And I saw no surgical site, but if I did, I would assess for signs of infection, the diameter and length of the incision, the type of drainage and the amount, but I saw none of that. And so I'm going to inspect her upper extremities. Okay, skin is pink, white, and dry, or warm and dry, pink, warm and dry. And I check her capillary refill. Okay, and it's less than 2 seconds. Can you place your palm up? Okay, I check her radial pulse. Her pulse is strong. And can you move your arms like this, please, for me? All right, towards yourself and back, up over your head. All right, her range of motion is good. Can you pull my fingers? All right, she has strength in her hands. And have you noticed any tingling, weakness, or numbness in your arms?
No.
All right, and I check the radial pulse in her left arm and the capillary refill, and they are bilaterally symmetrical, so less than 2 seconds for her left arm as well, and her radial pulses are bilaterally symmetrical as well. And I check, and now I'm going to check your lower extremities. Okay, I get the pedal pulse, all right, and it's a strong pulse, and I check her capillary refill. It is less than 2. I notice that her skin is warm, pink, and dry on both legs. There's no edema or lesions. I also didn't see any edema or lesions on her arms. And I'm going to check the capillary refill on this leg and the pedal pulse, and they are bilaterally symmetrical. I see her heart rate is 68, and her skin on both sides looks good. And do you have any weakness, tingling, or numbness in your legs?
No.
All right. And can you turn over for me? I'm going to assess all your pressure points. She has no pressure wounds on her back or her legs or her heel. And I check for skin turgor, and she shows no tinting. And how has your stay been at the hospital?
Good.
Good. Is there anything I can do for you before I leave?
No.
All right, thank you.